So Mr. Shiv Prasad Rao, 67-year-old male, he presented to us with liver cirrhosis and a diagnosis of hepatocellular cancer. We were thinking about a liver transplant for him because liver transplant was the most appropriate treatment for his stage of cirrhosis and cancer. However, at the time of evaluation, we found that his heart has got critical stenosis, and our cardiologist, Dr. Manoj Agarwal, did not give him a clearance for undergoing a transplant because he was a very, very high risk for having an adverse cardiac outcome on the operating table itself. So we put a multidisciplinary team together to figure out what is the best way for us to go forward with his treatment. And we had our cardiologists involved, Dr. Sanjay Agarwal from the cardiac surgery team, our anesthetists, intensive care people, and Dr. Manjunath from anesthesia and critical care. All of us, we got together to figure out what is the best way to deal with this situation. And then we decided that in the light that he requires to undergo a transplant quickly because of the tumor being present in the liver, the best thing for him would be to undergo a combined cardiac surgery, which was a coronary artery bypass graft and a liver transplant in the same setting. So we did the surgery. The cardiac surgery was done first. Beating heart CABG was performed, and followed by that we did the liver transplant. Mr. Shiv Prasad Rao's daughter, Mrs. Rohini, came forward to donate a part of her liver. So a live donor transplant was performed along with CABG, and today it's nearly 5 weeks after the surgery, and both the patient and the donor are doing well. It is not a very common thing to be done in liver transplant practice, and it requires a lot of multidisciplinary coordination, the approach, teamwork, and along with that a good infrastructure to make sure that the recovery, everything happens very, very smoothly. So we are very, very proud to say that we are privileged to work in Apollo Hospital, which gives us all the infrastructure. It is a good platform where we find specialists who are good, excellent in their respective fields. So working in such an environment, we are able to do this kind of rare procedures.
I am N. Shiva Prasad Rao, age about 68 years. I worked and retired as Chief General Manager of NABARD. I retired in Calcutta. And last so many years I never went to any hospital also because I never had any trouble. Some 2 months back I had a fall from staircase, then some eye problem was there. During this process they have done ultrasound and other things. They found that there is a small tumor in the liver. Then immediately I came to Apollo because I know Apollo from long time, though I have not come for treatment, etc. Being a HRMD person in NABARD, all our officers, they used to go to Apollo Hospital and they got very good results. As a result, I came and I met Dr. Manish also. I was very much convinced. Then he made it very clear. And initially it was only liver transplantation through cadaver. Then I was not very much worried. Then I was prepared. Then after that, one by one, more and more shocks came. Ultimately, cardiac problem also came. Then Dr. Manish told it has to be done in a very planned manner, and it will be possible as far as live donor is concerned. So we have agreed for that. In between, my daughter also, in spite of preventing her several times, without informing also, she came and she has done her workout, etc. And ultimately, she prepared to gave her liver for me, donated her liver. Because of her and because of Apollo doctors team, today I am here and talking like this. As far as hospital doctors and services are concerned, really I am amazed. During the pre-operation time also, several times, because we don't know anything in medical terms, we used to have a lot of doubts. We used to ask them very convincingly in a cool and calm manner. Dr. Shashidhar, Dr. Manish and so many his team members, they used to explain more than me. my daughter tortured them with so many questions, and very fully they explained the entire procedure. And after operation, it was really surprise to me. 24 hours, the care they have taken, really, I'm very much surprised. Even small cough means immediately 2-3 doctors they used to come. They used to see, and all vital parameters continuously they were monitoring. Any small change means they used to come and give immediate medication, etc. And within hours they used to saturate the whole thing. And I am very much thankful to Apollo Hospital and her doctors for giving me such a nice treatment. Today I am here, I am talking nicely because of their treatment, their love, affection, and their dedication towards the profession. Operations, many operations they will do, but that much of dedication, it is very important. Because of them only today I am survived and I am here. Thank you.
Hi, I'm Rohini Deepti. I'm 34 years old, and I'm mother to a son who is 2.5 years old. So I got to know about dad's condition around mid-October, and we've consulted multiple hospitals, and then we somehow got a very strong recommendation for Apollo, and we happened to meet Dr. Manish for a second opinion originally. But after meeting him, somehow there was this such a positive and strong vibe that there was some kind of comfort within all of us, and I think immediately the next week, like within 2-3 days, we went and met him again and discussed the whole case in detail, and we decided to do it here. Since then, we've run multiple tests. Dad cleared all his tests, and we registered for a cadaver liver for his transplant. But towards the end, when we got to know that there's this complication with the heart and we'll have to do a double surgery, that is for the heart and the liver, and the only way was to do a live liver donation. So at that point, I was initially very scared about the whole living donor situation and all, but I read a lot, and more than that, within this 1 month when we've been consulting with Dr. Manish and his whole liver team, I started trusting these doctors a lot, and there was some kind of positivity that was around me, and I wanted to give it a shot. More than anything, I remember Dr. Manish said that a lot of them don't really get diagnosed at this early stage. One, we were too lucky to actually know about dad's condition, and two, we have an option to cure it. And when there's an option to do something about your situation, I think you should definitely give it a try. So the reason why I was scared about giving my liver to dad was because I was not aware that liver is something that could be regenerated and there's very little or minimal complication for the donor when you do something like this. So all this I think is because lack of knowledge. I'm very well educated, but I've never really, come across something like this before. So I think if you take a simple example of C-section, number of C-sections in the country, there is so much awareness. It is such a common procedure across the country, world, that you don't even think twice before, performing the procedure and getting the baby out. I think at some point, liver donation should become something like that. If a lot of people get to know about liver donation, and if they can actually make this common procedure, if this knowledge can pass on to a lot more people, I'm sure there will be a day when, lot more people will come ahead without thinking too much, without being too scared about the whole procedure, and go ahead and save a lot more lives. My personal experience, this is like fifth week from post-surgery, and I'm able to do everything. All my tests have come out as normal. My liver seems to be doing well. I am on zero medication right now. I think, in fact, I've been on zero medication since day 4 of surgery. The initial few days, I just took some painkillers to cope with the pain. which I think is common with any surgical process. This is very similar to any surgical process basically. So I would just say, if you have a chance to save someone's life, don't think twice. Please go ahead and do the good deed. I think there's no better feeling. I think nothing can come close to the feeling of saving someone else's life while you're alive. I think it's a great thing. You should definitely do it.